Views and comments expressed on this program are not necessarily those of WMBM Media Group, its staff, management, or advertisers. Gospel AM 1490, WMBM.
Welcome to Safety Matters, sponsored by Community Care Resources of Florida, your health partner providing comprehensive, confidential services related to HIV, STD, and STI. Always practice safety first and know your status. And now, Safety Matters.
And welcome back, listeners. Welcome back, Community Care Resource Team, WMBM listeners. I'm Victoria Barnhart, the CEO of Community Care Resources. We have our social worker, which is Tamika Wood. She's employed at Community Care Resources. And Tamika has years of experience with a passion for social work. She is going to share with us about mental health as we're celebrating and ending the month of May with Mental Health Awareness Month. And hi, Tamika. Thank you so much for joining us today. We're having trouble connecting the call, but when she joins the call, we will we'll continue with the segment. But Community Resources is located in Hallandale. Are you there, Tamika?
Yes, I'm here. Can you hear me now?
Yes, we can. I think we're having technical difficulties. Well, welcome to our segment, and I will reintroduce you again to the listeners and also to the Community Care team and also the Community Care Resources patients and the WMBM listeners. Tamika Woods has years of experience with a passion for social work, and you will be engaging us with mental health awareness because we're still just celebrating and partaking into Mental Health Awareness Month. For some, they think mental health is a stigma. It's not. It's not nothing bad, but, mental health is for everyone. We have to have that mental moment. And I just wanted to say with Community Care Resources, thanks again for tuning in, that we're located in Hallandale, Altamonte, and Winter Haven, open Monday through Friday from 8 a.m. to 5 p.m. And just in case you're seeking services from one of our centers or our clinics, our toll number is 1-877-287-2520. Tamika, can you start, just give the listeners a background of what you do?
Yes. So I just do want to say I am grateful to be on WMBM, and thank you, WMBM family, for having me. And so as Victoria introduced me, I am Tamika, and I am the social worker at CCR. And I'll just give you a little brief background about who I am. So I graduated from Bethune-Cookman University in 2015, and I also attained my master's degree in social work from FIU. I've been a part of CCR for about 2 years now. Also, I do have a mental health background with working with the mental health background and population since 2015. I worked at Henderson Behavioral Health as a case manager there. I also have experience at Memorial Regional Hospital and also at Gilda's Club. I also did a few chronic cases with mental health with the population. So I do have a great amount of health experience, mental health experience, and I love discussing about mental health. So thank you again for having me.
All right, and thank you for taking the time out to join us on the station. And once again, I just wanted to just let you all know that Community Care Resources, we are a test and treat center. We specialize in PrEP and PEP education and preventive medication, but we also have social services available and social work services available to our patients just in case when they're diagnosed or they have received some bad news or have received some good news and wanted to learn about other steps in progress to keep it up because they may have had a little risky behavior. But we provide that within our center. And Tamika, I would like to for you to tell the listeners what is social work and when should they seek a social work? But what does a social work do? A social worker does.
Okay, I'll be glad to answer that. So I just wanted, the way I'm going to start it off, it's going to seem a little like you're like, what is a social worker? So The way I'm start off, I would say that God has created all humans, and I promise you will see where I'm going with this, because you may be trying to figure out what does a social worker have to do with God creating humans, and so as I stated, God has created humans, and He also blessed us all with a gift. And my gift is helping people within the community. That is what social workers do. So we basically assist individuals within the community to cope with their daily problems. So, like an example would be housing assistance. You may need somewhere to live. Trying to find out within your city who's having like HUD. Also, insurance. Let's say you have a chronic condition, or may not even have a chronic condition. May try to figure out how you're going to afford your bills. We also have we also provide for medication assistance. So let's say that you may try to figure out how would I pay for my medications, or you may have a chronic condition, and with the chronic condition, it's very, very expensive to afford medication. So an example also for that would be the HIV medication. HIV medication costs around $3,000 or more dollars. So we also provide assistance with that, and also emergency assistance. So a social worker will help with locating like a shelter or a clothing support group. Well, support group for like, let's say, for shelter and clothing. So social workers link you to these services and provide resources for you. And this is what I'm here for, to take a load off of providing these resources, because individuals may not know who and what to turn to. So we help them with their first steps to take. Not only that, a social worker also, if you are in need of someone to speak to, individuals go through daily problems every day. We all go through problems each and every day. And this is where social workers come in at, and we listen to, and we do active listening skills, and we just listen out to what you have to say and guide you through it. So some patients or some individuals may have depression, and you just want to let it all out. I'm here to listen. Some have substance abuse and want to know, where do I turn? Who do I speak to? What are the steps to get through it? So you may just need some type of help or someone to talk to. So this is what a social worker do, and we serve within that community. And social workers all serve within the community in different ways. So you may know of a social worker that works at a hospital or a mental facility. But for me, I'm serving within the HIV and STD population, and this is how we decrease the rate within the HIV population, the STD population, because of Florida being one of the highest states within the United States that has the highest HIV rate, one of the highest actually HIV rates. So this is where a social worker comes in. We help in every way within the community and provide with these resources. And this is why we have a CCR, not only for you, but also for the community.
Great, and thank you so much for giving that background and that detail, because some people look at social work, why do I need social work? Why are you referring me to social work services? So how do, let's say, for instance, a walk-in, a day in life at CCR, how would a patient qualify when they're with the provider or with the counselor or the prevention counselor? I think you may need social services. I may think you need a referral for social service, or you may need to see a social worker. So how are we able to help that patient once they're in CCR and they want to help a social worker? Like, what are the little triggers to say, hey, I just want to talk to you?
Okay, so when you first walk in, some people try to figure out how would a social worker come in need at a touch and treat. And so first you will meet with our friendly front desk, and then next you will meet with our amazing counselors and nurse practitioner. And during that session, you will discuss your needs. So whatever brought you in that day, you will explain that to the counselor and nurse practitioner. And some triggers can be, as the counselors and nurse practitioner will look at your body movement or the information that you're providing them with, and they're like, okay, maybe you are in need of social work services because you're maybe a little depressed. And let's say a patient comes in and they test positive. And I do want to get on the subject as a patient tests positive. When a patient is tested positive, they're sometimes stigmatized because they results came back positive. And so there's a lot of stigmatization when it comes to a patient come back with a positive result. And so I do want to touch bases on that also. So if a patient comes back positive, sometimes it's not the patient. Sometimes it can be the spouse. The patient can be married and be very faithful and committed within their relationship, and they come back positive because of maybe their spouse did something inappropriately or stepped out of their marriage. And not only that, you don't only test positive for like STDs and HIVs, you can also test positive for Hep C. And that goes back to stigmatization testing positive. So you come back with Hep C being positive, sometimes you don't even, it could have been that you went to a tattoo artist. You maybe went to get a nice little tattoo and you end up testing positive for Hep C because they didn't sterilize the needle. So there's a lot of stigmatization when it comes to testing positive, and this is why we're at CCR, where there's a no judgment zone, because we understand and we know the risk factors that's out in the world, and you may not even had anything to do with it. It maybe just came upon a time where it could have been your spouse. It could have been because of a tattoo artist, as I explained. And the difference with between with CCR is that we're different from other clinics. We're different from other test and treat places. As you will go and get tested at your PCP, at your primary care physician office, they're there. They provide you the test results. Here, you're positive. That next step, they're just there consoling you for that few minutes. After that, you're gone. Now you have to find out how you're going to get through this situation and how you're going to continue to cope with life. Or you go to a test and treat, they just provide you those results. Here at Community Care Resources of Florida, you'll follow up with a social worker. Not only does the counselor see you, they refer you out to the social worker, which is myself, where I will guide you, I will help you, I will hold your hand, not through the journey that you're going through. And it can be for a weekly session. It can be for every once a month, depending on your mental status and how you're coping with it. So I just want you to know and let the listeners know that CCR is different from any other clinic, any other different test and treat, and we're here to let you know that you're not alone, and we will walk you through your journey.
Thank you, Tamika. And that is so correct that we provide all types of services, and all of our counselors have mobile phones, including our social worker have mobile phones, our managers, our practice administrators, our nurse practitioners. We have company phones, so we're here for you at all times. And you can text, you can call, you can also reach us on our portal where we have our EMR system. So you have 24 hours access, but I'm not going to say that we're going to call you back immediately, but we're here for you. But you will receive a response back. Because we do receive those late night calls, we do receive those early morning calls when someone make a mistake. But with social work services, it's very important to be engaged with someone, because you don't know their status at that point, or what they're going through, or what they're hearing because of bullying, or just someone just going through a depression or a meltdown, and they just need to talk to someone. So, like, Tamika, what is the engagement for the type of ages or the young population, or understanding that someone is here for them? How do we help engage or gauge someone is young, a young person?
So let's say a patient is very young and they're just we're trying to help and engage with them. So the first step would be to build rapport with the patient, because they're young. It's very hard to open up. Sometimes they feel like you may not understand them. So I do want to say we all was young before, and we all remember when we were like 15, 16, and we don't want everybody in our business. So the first stage, the first goal is to build a rapport with the youth. And the way I built that rapport is just sitting in and just listening out to them, or just asking them the frequent questions, because they may just sit there and they don't want to talk to you. They may I don't know what to say. I don't know how to say. I don't know what to say next. And so they may not feel comfortable of providing with the information, because it's a lot of judgment of the youth and what they do and how they're handling within today's society. And so building rapport is the most important thing. Listening to them, or even asking them questions just to understand them, to see what they're going through and their thoughts and their process and how to deal with it. And you just help and guide them and hold their hand as they're going through their journey, and just trying to understand what the youth are trying to say and where they're trying to go, and the guidance, and just knowing that someone is there for the youth. It's like they're judged based off how they're acting and what they're doing, and another thing is, because of what we went through and how society has changed tremendously, it's like the older crowd is like, why are you doing this? Why are you doing that? You should not do this. You should not act like this. Where with the social worker, we're just here to listen, to guide you, to help you, and to understand where you're coming from. So it's mainly important to build rapport with the youth.
Great, and that's what we want the listeners to hear, that there's someone that you can turn to. Maybe it's not a CCR, but there's someone there that you can turn to. How about with substance abuse or recovering addicts that's turning and trying to change their lives? Like, how does a social worker engage with them on treatment goals? How do you engage with them, Tamika?
So what I would say is, substance abuse, and I honestly, substance abuse is very, very hard. It's one of a few of the toughest to deal with, because it's a lot of cravings that really affects the patient. And the best thing to do is being by their side. That is the most important thing to do, because they're going to go through a lot of cravings, and cravings is basically feeling of wanting, the urge of the, let's say, if you're using a certain substance. So you're going to have these urges where you may be laying in bed, and also these triggers. And the hardest thing is just to walk away and really understand that you have to have ground techniques. Ground techniques is a social work skill that we use. Also, the coping skill strategy. There's so many strategies that social workers will need to provide to understand and to get through it, because you cannot get through it alone. So I feel like it's very, very important for any substance abuse users to know, always go out and get help, because sometimes you feel like you can do it on your own. It's not easy. And I totally understand it's not easy. And this is where we come in and we help and we guide you. Please have and ask for help. And also have a support system. Support system is very, very important during that stage. You don't want to never feel like you are alone. So please, any substance abuse users, always have support, system support, and also reaching out to resources, looking for and seeking for resources where social worker can provide you these resources, and also following up with a therapist is very, very important.
And it may be uncomfortable to answer some of the questions when you're in a session or a setting such as ours, but we're not, just to let the listeners know, when, like in a doctor's office, it's very important to answer the questions truthfully, to be honest, because we're trying to create a map to assist you with meeting your goal. And in social work, as I can hear, Tamika, the way you're engaging with the patients, that you may have a series of questions that you want feedback from, and I understand that they may shut down on you, and then you have to try to rebuild or request or ask the question again in a different phrase or in a different way, or when they feel comfortable being asked again. But it's not where you're feeling that someone's trying to get in your business. This is a confidential center. This is a clinic setting. So your records are your records, but I want you to know that this is a confidential setting. And to me, can you just advise a little bit about the confidentiality and how it's important for them to engage in the questions and answers?
Okay, so confidentiality is very, very important. Anything that you discuss with anyone at Community Care Resources of Florida, it does not go outside that door. It is against HIPAA. That's number one. Even if you are young and you need someone to talk to, we are not advised to give any information. So we are an open door, and we have all your information closed in. So confidentiality is very, very important. We are big on confidentiality at Community Care Resources of Florida. Also, when it comes to individuals and patients that may not want to speak, they may want to shut down, they may not want to open up, and that is okay. That is okay. We're going to have sessions like that. That is fine. That is totally fine if you just don't want to speak. But eventually, if you want help, you have to seek for help, and and if you want help, you have to speak up, and you have to tell us what is going on. You have to explain to me as a social worker, what are your needs? Because the only way I can help you is if you want help for yourself. So if you need assistance, I am here to help. I'm here to listen. If there's time that you want to come in and you just want to shut down and not speak, that's fine. And as I explained, I am here, and I will ask you the questions. I will make sure I ask the correct questions to make you engage and eventually engage. And that goes back to building rapport. I will learn who you are and what do you like and what do you do not like. So a great question would be like that I ask a patient, and that would be building rapport is maybe I'll do an icebreaker. And my whole goal is to find out what makes you happy. What can I do for you? How can I assist you? That is my goal. My goal is to get you to where you want to be and what the services that you came here for. So I'm going to make sure I engage with that patient to find out as much as I can as possible. So an icebreaker is one game that I would do. Also, just asking for any questions. And I'll eventually get something out of you. I promise I will. I may ask your favorite color. Just knowing your favorite color is enough. Just knowing what you like to do, your hobbies. And this is where I come in. I may even bring you something similar of your hobby, or we can talk about your hobby. We can even have a discussion about your hobby and like what you like to do for fun. It's better than nothing. And this is how I get the patients to engage. And then eventually we will build rapport with one another, and we will the patient will eventually opening up. So that's the little techniques that I use to get the patients engaged and to open up during the session.
Great, and that sounds great and sounds very exciting that I'm quite sure they want to keep coming back, maybe more than 2 or 3 times a week. And can you provide the listeners with some mental health resources or resources for Mental Health Awareness Month before we close out? We have like 5 or 6 more minutes left before I go into the field. So what resources are available for Mental Health Awareness Month?
So I do want to say it is, as Victoria said, it is Mental Health Awareness Month. And it's very, very, I'm glad they came up with Mental Health Awareness Month, because before mental health was not as big. A lot of people didn't pay attention to it. A lot of people still throw it under the rug. A lot of families and parents don't believe in mental health. And what I do want to say is, even if you don't believe in mental health, and sometimes you may need someone to talk to, that please join a counseling session. Please go out and speak to someone. Please engage with your family and friends. Mental health is real. It's very, very real, and I love focusing on it because I do have family members that does have mental health illness, and that's why it's very a passion for me to even to discuss and talk about mental health, and that's why I'm very, very grateful to be on a radio station today to even talk and discuss about mental illness. So there are a few resources, and before I give you that, mental health illness, and one of the biggest ones is depression. Depression has skyrisen. Also, even during the pandemic, depression has spiked within the community, and so I would love to give mental health resources. So one mental health resource is the National Alliance of Mental Illness Association. So the National Alliance of Mental Illness Association is an educated mental health. Basically, it's a website that you can go on, and they provide a lot of resources and education to understand what mental health is. And also, they do have a hotline to provide support and practical next steps. So you may not know what are the next steps if you find out that you are mentally ill. So you can also contact the National Alliance of Mental Illness Association, which is 1-800-950-6264. We also have...
Can you repeat that number again?
Okay, sure. The National Alliance of Mental Illness Association, their phone number is 1-800-950-6264. And as explained, they do have a lot of educated information about mental health if you want to learn a little bit more about mental health illnesses, and they also have the hotline to provide support and practical next steps. The next resource I will provide is the Crisis Text Line. This one is just so awesome. It is a free 24/7 support. You will receive support from crisis counselors. You can text at any time. You can text help. And if you are going through a crisis, the crisis counselor will text you back. And this is very great if you don't want to talk to someone on the phone. You can always text. This can be for the young generation. This is one of the best resources that I provide to my patients. So that is, you can text at 741-741, and you can just text help, and they will respond immediately. Again, text 741-741. The next resource is the National Suicide Prevention Lifeline, and you can contact them at 1-800-273-8255. Again, 1-800-273-8255, and that's the National Suicide Prevention Lifeline. Next is the Trevor Project, which is very, very great. It's for the LGBTQ. It's a crisis hotline. It is 24/7. It's for the young LGBTQ community. You will have to be under 25 years old, but they are the same where they text you immediately. It's 24/7. This is very, very great for our young LGBTQ community. You can also text this. The 24/7 hotline is 1-866-488-7386. 1-866-488-7386. Also, we have the National Association of PTSD. That is 1-800-273-8255. Again, 1-800-273-8255. And the last one, for our veterans, our crisis line is 1-800-273-8255. So you have that number also. So if you may have PTSD, any substance abuse, or mental health services, there are 24/7 helpline. Right. So I'm glad to provide you with these resources for Mental Health Awareness Month.
And thank you, Tamika, for providing those numbers and great resources. And we want to thank all the CCR team and the WMBM listeners for joining us this week. And we'll see you again on Wednesday. Make it a great Monday. Thank you, everyone.
Thank you for having me, WMBM family.
You have been tuning into Safety Matters, sponsored by Community Care Resources of Florida, your health partner providing comprehensive, confidential services related to HIV, STD, and STI. Always practice safety first and know your status. Log on to CCRSFL.com. Call 877-287-2520. That's 877-287-2520. Join us each Monday and Wednesday at 4:30 p.m. right here on Gospel AM 1490 WMBM.